Hi, I'm Nancy with Odonata Care. I'm one of the co-owners along with Brenda Kazire. We wrote the booklet, The Care Plan, A Path to Comfort for the Hospice Patient. And today I'm going to continue along with our series of symptom management. How can we feel better by managing symptoms that come up in the end of life, or actually any time of life? So today we're going to talk specifically about nausea, vomiting, queasiness. Sometimes people call it being sick to one's stomach. And of course, what would be our goal? To be able to get back to enjoying eating and drinking all the foods and fluids that we really enjoy. Do know that nausea, if it's long lasting, can be actually more miserable than pain. And it can cause depression if it goes on very long. Of course, it would contribute to weight loss. And if you're close to the end of life, it can actually hasten death. Due to the dehydration. Actually, dehydration is normal, but we don't want it to be caused by nausea or vomiting. So, what to do about it? First of all, it's really important to investigate the cause. Can you find out what is causing the nausea? And if you're looking at another person, did you notice over time that they have no appetite anymore? They're just not interested in food or fluid. It's really important, of course, to ask them, is there a reason you're not eating or drinking? Did you just lose your appetite, or are you actually feeling badly? Do you feel nauseated? Do you feel like you're going to vomit? It's really important to gather information so that you'll know how to approach it. Of course, it's really obvious if they're gagging, they're vomiting, having dry heaves. Clearly, they've gone beyond nausea into vomiting, and we certainly want to prevent that if possible. So do look at some investigation. Has there been an introduction of a new medication that now there's a pattern after that medication is taken that they're nauseated or even vomiting? Have they tried some new foods or fluids that don't agree with them? So find out if you can see a pattern. Does it happen always in the morning, or is it at bedtime after they ate and then they lay down too soon? So you really need to gather as much information as you can. So now let's say that they are nauseated. What to do? Certainly have the person sit up. And of course, you might want to have a bowl or a basin handy just in case it does extend into vomiting. Have that patient or yourself sip on some room temperature ginger ale, Coca-Cola, flat soda of some kind, a mint tea, ginger tea. That can really help. And if that does help, great. Just go back to being slow and increase your intake as you're comfortable. If the nausea goes away, great. If you are nauseated, do not eat anything because you certainly don't want it to come back up. So don't eat if there is nausea. Don't progress into giving food. If there is no relief just from, as I said, sipping on things, you might look at the medications that your team has given you that will help to stop nausea. Do know that sometimes if it's severe, we do give rectal medications to stop nausea because, of course, if they put it down into their gut and vomit it back up, that medication hasn't done any good. If a patient is actually extended into the position of vomiting, having dry heaves, do not try to intervene. Of course, get that towel, bowl, whatever it is. Support them so that they can continue that action until their gut is empty or until they're able to stop bringing anything up. And then, of course, do not give anything else at all, fluid or food, for at least 30 to 60 minutes. Really wait and make sure that that nausea has passed. When you're ready to start refreshing and replenishing fluids, you want to go extremely slowly. 1 tablespoon in a half an hour, literally 1 tablespoon. If they tolerated that, they want a little more, 3 tablespoons. Wait another half an hour. If they did well for that hour, then it's okay to then continue to take in what you'd like or what they'd like. Sip on a few things. Don't overdo it, and certainly don't put any food in the gut right away. Let's just make sure the nausea has been able to be put aside. How do we prevent nausea? I didn't mention it before, but being constipated is one of the primary problems that cause nausea. So watch our video on constipation, and we're talking about having a normal or at least an adequate, comfortable bowel movement at least every 3 days. Stay on top of that and prevent the nausea. What else can you do? Eat very small, frequent meals. Just take in less. Don't let your tummy get over full. Eat the foods that are familiar and that you really enjoy. Don't try something that's really unusual if you have had some tendency to have nausea. Make sure you sit upright for an hour after eating. If a patient is in a bed, do not lay them flat. You certainly don't want to encourage nausea or even have reflux into the esophagus, which could cause burning and even cause nausea and more vomiting. So, hope all of that helps and everyone gets back to one of the major joys of being human, eating and drinking what we love.